Okay, so I am here today to administer medications to my patient, Mr. John Smith, date of birth 2/26/1943. I'm going to first start by going over here to my charts and finding the right chart. And I have here John Smith, date of birth 2/26/1943. John Smith, date of birth 2/26/1943. I'm going to go over to my first check station. I know I'm going to need my physician orders, my insulin orders. I'm going to need my medication administration record for my POs and injectables, as well as for my insulin. We'll have those two pieces of paper. And I'm going to set my chart down there. Start by spreading out all of my pieces of paper. All right, so again, I have John Smith, date of birth 2/26/1943. John Smith, 2/26/1943, no known allergies. 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 Okay. So I'm going to start with my first order here. Finger stick blood glucose, AC, and bedtime. Over here, this MAR here. Finger stick blood glucose, AC, and bedtime. That is scheduled for 7:30, 11:30, 16:30, and 8:30. I'm going to date and initial that. My next order, insulin sliding scale protocol. So now I'm going to go to my insulin order sheet. And I have here insulin to be used for both prandial mealtime and sliding scale is insulin Lispro Humalog subcutaneously based on finger stick blood glucose and patient's BMI before meals and at bedtime. And the BMI 25 to 30 moderate resistance column is checked. I have here Humalog insulin subcutaneous for insulin sliding scale protocol, AC, and bedtime. The moderate resistance BMI 25 to 30 column is checked. And my times are 8 o'clock, 12 o'clock, 1700, and 2100. Okay, so I'm going to date and initial that one. Next I have digoxin 0.125 milligrams PO daily. I have here digoxin 0.125 milligrams PO daily. It is scheduled for 8 o'clock. It is now 8 o'clock. I'm going to hold if the apical pulse is less than 60 beats per minute. Okay, so I'm going to initial that. Okay. My next drug is furosemide Lasix 40 milligrams PO daily. And I have here furosemide Lasix 40 milligrams PO daily. It is scheduled for 8 o'clock, and it is 8 o'clock. So I'm going to date and initial that one. My next drug is Coumadin. Excuse me, I skipped one. I'm going to come back up here to potassium, 20 milliequivalents PO BID. Potassium, 20 milliequivalents PO BID. That is scheduled for 0800 and 2000, and I'm going to give the 0800 dose today. Date and initial that one. Coumadin, 5 milligrams PO daily at 1700. Coumadin, 5 milligrams PO daily at 1700. And it is scheduled for 1700. I won't be giving that one, but I'm checking that the MAR is correct here in my first check. And finally, we have ketorolac, Toradol, 15 milligrams IM every 6 hours, PRN, severe back pain. Ketorolac, Toradol, 15 milligrams IM every 6 hours, PRN, severe back pain. And I will be giving that dose at 0800. He has not had it in the past 6 hours. I'm going to date and initial that. This time I'm going to sign an initial down here, and I'm going to sign an initial over here. Okay, so that is complete for my first checks. I have reviewed my hospital's policy and procedure for timing of medication administration, which I can give the medication within 30 minutes before or 30 minutes after the scheduled time. I have also reviewed for each of these medications, I've reviewed the drug action, the drug purpose, the recommended dosage, time of onset and peak action, the common side effects, the drug contraindications, the drug interactions, and the nursing implications. Okay. So at this time, I'm only going to take my MAR with me. I can leave the physician's order back here with the chart. And we're going to come do our second checks. Okay. So our second check, I'm going to need a tray. I have a medication cup for my PO meds. I'm going to use a second cup for the meds that I have to assess the patient prior to giving, like blood pressure or pulse. So I may keep those in a separate cup. And I'll be doing injectables as well. Okay. So again, I have here John Smith, date of birth 2/26/1943. John Smith, 2/26/1943, no known allergies. John Smith, 2/26/1943, no known allergies. I'm going to come here and grab John Smith, 2/26/1943. I could pull this tray out here. And at this point, I'm going to say call light because I'm going to need a pen. Thank you. Okay. So I'm going to start with my PO medication. So I'm going to set that stuff aside for just a moment here. Okay. So I know that I am giving potassium, 20 milliequivalents. So I'm going to find this first. Okay. Potassium, 20 milliequivalents, PO, BID. I am giving the 0800 dose, and it is 8 o'clock in the morning right now. I have here potassium, 20 milliequivalents. It is a tablet, so that's an oral medication. It expires 3/16. Set that there. The next medication is furosemide. Come in here and look for some furosemide. Furosemide Lasix, 40 milligrams PO daily, scheduled for 0800. It is 0800. And I have here furosemide, 40 milligrams. It is a tablet, so that's PO. And it expires 10/2016. I am not giving the Coumadin at this time because that's a 5 o'clock dose. Next, I have digoxin. So I'm going to come in here and look for some digoxin. Digoxin, 0.125 PO daily to be given at 0800. It is now 0800. I'm going to hold if the apical pulse is less than 60 beats per minute. And I have here digoxin, 0.125 milligrams. It is a tablet, so that's PO, and it expires December of 2015. Okay. And I'm going to set this in this cup right here because I will take the pulse before I do that one. Okay. So at this point, I can put this tray back, get this out of my way. So I do have John Smith 226. Set that down there. Okay, next medication, I'm going to go ahead and do my IM medication right now. I'm going to give Ketorolac, or it's also known as Toradol. So I'm going to come here and I'm going to grab my Toradol. And I'm just going to set that up here for right now. I know it's an IM injection, so I'm going to need a 3 ml syringe. It's a 23 gauge 1-inch syringe, and that's the appropriate needle size and volume for my patient and for the medication I'm administering. Reset the moment because I never did hand hygiene when I walked into this area, so I would have done hand hygiene. Okay. I'm going to do hand hygiene again. Okay. All right, so back to my business here. So I have an order for Ketorolac, Toradol, 15 milligrams IM every 6 hours as needed for severe back pain. It has not had it for 6 hours, and I am giving it at 0800. I have here Ketorolac. It is 15 milligrams per mil. So I'm going to grab this other piece of paper here just to do my calculation. So I have 15 milligrams in 1 ml, and I want to give 15 milligrams. So D times Q over H. Dose is 15, quantity is 1, and what I have on hand is 15 equals 1 ml. So I'm going to draw up 1 ml of this medication, and that will be 15 milligrams. I'm going to start by opening my package. Be careful not to contaminate the hub of the needle. So I'm going to set that down. I can come in here and grab my blunt plastic cannula. Rub the hub of this vial for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 15, 14, 15. 1 ml of air. Inject the air, invert the vial. Switch this over to this needle here. Set that down. I normally would discard this in the sharps, but we are reusing those, so we set that back in that container right there. I'm going to find a label. Got Toradol here. I'm going to label my syringe, making sure not to cover this. So, again, I have an order for 15 milligrams of Toradol. IM every 6 hours is needed for severe back pain. The time is 8 o'clock. It is now 8 o'clock. I have here ketorolac, 15 milligrams per mil. I have 1 ml in here, so that is 15 milligrams. I'm going to show this to my camera person to verify it.
With the bottle, the way. Here you go. Okay, good.
Okay. I'm going to read the vial one more time. Ketorolac, 15 milligrams per mil. If this was empty, I would just discard this in the sharps, but it's not, so I'm going to put it back in the drawer. I can set that down. Okay, so that's that. Next thing I'm going to do is I'm going to do my insulin injection, or prepare my insulin now. Okay. So on my worksheet here, the patient's finger stick blood glucose was 284 at 7:30 this morning. So I'm going to write 284 in here. Put my initials there. So, Humalog insulin subcutaneous per insulin sliding scale protocol, AC and at bedtime. The BMI 25 to 30, moderate resistance. At a blood sugar of 284 is 7 units. I'm going to give 7 units at 0800. I'm not going to initial that because I haven't done that yet, but I'm just writing down the 7 here. So I'm going to come over here and I'm going to grab Humalog insulin U100, expires June of 2016. The right medication there. I need to have an insulin syringe, so I'm grabbing a insulin syringe for use with U100 insulin only. It's a 29 gauge half-inch needle. This is the appropriate size of needle for an insulin injection based on subcutaneous injections. Again, 15 seconds scrub. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Inject 7 units of air in the vial. Set that down flat like that. Invert my vial. Surface. Put the label on here. And I have here Humalog insulin U100, 7 units, have a blood sugar of 284 in the moderate resistance. Got 7 units. It is 8 o'clock in the morning. And 7 units is here in the syringe.
Okay, good.
Good. Insulin, human log insulin U100 expires June of 2016. Okay, so I think I am prepared. I've got my insulin prepared. I've got my IM medication, 3 tablets. So I am ready to go to my patient's room. I need a cup for them to drink their medications with, a couple of alcohol swabs, a little bit of gauze. All right. Over here. Hi, Mr. Smith. I'm Brian. I'm going to be your nurse today. I have some medications for you. How are you doing today? Doing all right? Okay, good. First things I just need to do, I just need to verify who you are. So can you please tell me your name and date of birth? John Smith, 2/26/1943. John Smith, 2/26/1943. John Smith, 2/26/1943. Mr. Smith, do you have any allergies to any medications? No known allergies? No known allergies? No known allergies. Okay, great. Well, Mr. Smith, I'm going to be with you in just 1 second. I'm just going to do one quick safety check, and then I'll come back and we'll talk about all your medications and stuff. So just give me 1 second here. So come back over here. Again, I'm going to put out my 2 Mars here. Take my pills and dump them out of the bin there. So I have potassium, 20 milliequivalents, PO, BID, 0800 dose. It is now 0800. And I have here potassium 20 milliequivalents. It is a pill. Furosemide Lasix, 40 milligrams PO daily at 0800. It is now 0800. And I have here furosemide 40 milligrams, and it is a pill. I'm not giving the Coumadin. Digoxin, 0.125 milligrams PO daily at 0800. It is now 0800. And I have here digoxin, 0.125 milligrams. It is a pill. I am going to hold this if the apical pulse is less than 60 beats per minute. I'm going to put this in this other cup to remind me of that. And then I have here ketorolac, 15 milligrams IM every 6 hours. PRN, severe back pain. I'm giving it here at 0800 hours. The patient has not had any for the past 6 hours, so I know I got the right time. And I have here Toradol. It was 15 milligrams per mil, and I have 1 mil. So that is 15 milligrams. And finally, I have here Humalog insulin, subcutaneous per insulin sliding scale protocol, AC and bedtime, BMI 25 to 30, moderate resistance box is checked. The patient's blood sugar was 284 at 7:30, and that is 7 units. I'm giving 7 units at 0800, and it is 0800. And I know his food is on the way, and I have here 7 units. So that is the completion of my 3 checks. Go over here to Mr. Smith. All right, Mr. Smith, back with you here. So can you please tell me, let's reset the moment, I should have hand hygiene before I touch the patient. Can you tell me, are you having any pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst? No pain? Okay, good. All right. So I am going to go ahead and I'm going to start with your injections, because then I'm going to leave you sitting up at the end of that for your when your food comes. You have your breakfast. Okay. Providing privacy. So the first one I want to give you, Mr. Smith, is your intramuscular injection. This is your Toradol. It's a pain medication, and this will help relieve some of that discomfort you're having from your ankle surgery there. Okay. So there are 3 places I can give an intramuscular injection. The first one is in the deltoid muscle. That is up here. And to find the right spot, I put 2 to 3 fingers below the appropriate process. Make a V with my other hand. And the injection site is right here between my index and middle finger, right here in the lateral aspect of the deltoid muscle. Another location would be your thigh. To find that location, I'm going to place one hand out of the greater trochanter, one hand above the knee. The injection site is in the middle 1/3 of the lateral aspect of the vastus lateralis, here between my thumbs, right in that location there. The final location, the place where I'm going to give it today, is called the ventral gluteal muscle. To see that one, I'm going to have you roll onto your right side for me. Try to keep you covered just a little bit here. Get you positioned. You can have you flex your leg forward for me just a little bit. There you go. Okay, that. To find that location, I'm going to put the palm of my hand on your greater trochanter. My thumb is pointing towards the umbilicus. My index finger is on the anterior superior iliac spine. My middle finger is on the iliac crest. And the injection site is right here between my index and middle finger in the ventral gluteal muscle, right there. Okay. So that's the place we're going to give it today. Okay. Down here. I'm just going to move right over here to actually simulate the injection, but normally I would be right there with my patient. Okay. So I'm going to scrub the skin, injection site really good for 15 seconds. Use the Z-Track method. So I'm displacing the skin a couple of inches to the side, coming at a 90-degree angle. Okay, you ready? 1, 2, 3. Stabilizing the syringe, aspirating. I don't see any blood. I'm going to inject at a rate of 1 mil every 10 seconds. Immediately engage the safety device. I would not massage the side, but if I saw blood, I would dab it a little bit with some gauze. And I will put this immediately into the sharps container. How was that? Didn't feel a thing? Great. All right. So go ahead and roll back onto your back here, Mr. Smith. Excellent. All right. Next medication I'm going to give you, because your breakfast tray is almost here, is your insulin injection. This is your regular insulin. This will help keep your blood sugar in a safe range when you're eating your meal here, okay? So there are 3 locations I can give this injection. One is up here in the back of your upper arm, the posterior aspect of your upper arm. You find that location. I put one hand on the shoulder, one hand above the elbow, and it's in the middle 1/3 here between my thumbs in the posterior aspect of the upper arm. Another location would be on your thigh. To find that location, I'd put one hand about at the hip or greater trochanter, one hand above the knee. And again, it's the middle 1/3 aspect of the anterior portion of your thigh, right here on the top side. But where I'm going to give it today is in your abdomen. Normally this would not be there, but we're going to pretend it's not. In the abdomen here, 2 inches from the umbilicus, anywhere 2 inches from the umbilicus. And that's where I'm going to do your injection here today. Okay? All right, so we'll just come over here to simulate giving the injection. Good. Again, I'm going to scrub the site here for 15 seconds. Let that dry. Mr. Smith here is pretty thin, so I'm going to have to pinch to get enough tissue and go at a 45-degree angle. So I have my bevel up. So I'm going to pinch the skin here. And 1, 2, 3. Stabilize the needle. Inject the insulin and out. And just like with the IM, I'm not going to rub the site there, but if there's a little bit of blood, I'll just dab it gently. Okay, and immediately discard this and the sharps continue. All right, how was that? Is that okay? All right. Good. Now I'm going to go ahead and sit you up here. Do your oral medications. I need a stethoscope. If I could call light, please, and get a stethoscope. So I've got 3 medications for you. One is your potassium chloride. That's a replacement. That's a really important mineral. It helps our heart beat correctly. It's for muscle contraction. It's all our cells use potassium so that they function correctly. So that'll help replace some of the potassium loss that the other medication is causing. That's your furosemide or Lasix. That medication, it's your diuretic, which means it's going to make you urinate a lot. So people refer to it as the water pill. That'll help decrease some of that edema and swelling that you have down there in your legs. And then finally, the last medication is digoxin. And that's the medication that is going to help your heart beat more efficiently. It's going to slow the rate down a little bit and make each beat contract a little harder, so it makes it more efficient. Before we do that, I just need to listen to your heart really quick for 1 whole minute. Come up from the side of your gown here and finding the apical location here, which is the fifth intercostal space. And left with your line. Is 82. So I go ahead and give you the medication here. Let me suit you up just a little bit more here, John. And make sure you can swallow okay. I'm just going to touch you here on your neck. Can you swallow for me? Good. Want to take a little sip for me before? Okay. No problems there? Swallow okay? All right. Good. All right. Do you take your pills one at a time, or can I give them all at the same time? All at the same time? Excellent. I like that idea. Here's your 3 meds. We're in the cup. Here's your cup. Here's your water. Excellent. Okay, great. Well, that is all I have for right now, John. Your tray, food tray, should be here in about 10 to 15 minutes. I will make sure I check on that, so if it's getting any later, then I'll make sure I bring something for you to eat. Before that, though, I will make sure I'm going to come back in and check on you to make sure you're not having any problems with any medication, to check on the effects, make sure you're not having any problems. I'm going to go ahead and leave you sitting up since your tray is coming here, but the side rails are up, the bed is locked, the bed is in its lowest position. The call light is right here if you need anything. And I thank you very much for your cooperation. Do you have any questions for me at all? No? Excellent. Okay, I'm going to chart here real quick right before I leave the room. I'm going to clean up all my mess. And we'll get out of your hair. Okay, so I have given the Potassium, 20 millicones, PCO. I've given the Lasix, PCO. I gave the Ditch, PCO. His apical pulse was 82. I gave the Toradol, and I gave it in the left ventrogluteal, LV. And over here, I have given the insulin 7 units, and I gave that in the abdomen. Okay. Excellent. That's it. And